how common is lower back pain? Do you say low back pain or lower back pain?
Common is low back pain,
Okay.
and it's very common. It's like almost the #2 visit to medical office from patients in the United States. And unfortunately, the prevalence incidence is increasing over time. So more Americans are experiencing back pain in our industrialized nation.
Because we're sedentary, or because why?
Right. Most injuries are associated with desk and office workers. So we see a lot more back pain with individuals that are sedentary, sitting a lot, not changing positions. We also have the weekend warrior syndrome, where you are sedentary throughout the week and then try to do all your exercise in one bout.
So that's bad?
In general, yeah, you should have a balanced exercise program where you combine aerobic activity with flexibility, warm up, cool down, and some resistance exercise most days of the week, not try to get everything in 1 day or 2 days.
Okay, that's interesting, because I always feel like people have more time on the weekend, so they try to go for their like 2 hours on Saturday.
Right.
And why is that bad? Just because your body's in shock, or what?
Right. Weekend warrior syndrome is essentially you injure yourself when you're not warmed up and not prepared for an exercise, and that's kind of when you see our sprains and strains in the lower back very often, or anywhere else in the body.
And now, why is the lower back the area people get the problems in more than like the mid back or upper back?
Right, so there's a common misconception that we have like upper back pain, or traps have all these trigger points. Many times the upper back pain is really coming from the neck. So when we examine patients, we often find that the pathology or the problem pain generator is from the cervical spine or the neck. Mid back pain is very uncommon, I would say, and then low back pain is the #1 cause.
So blame the neck, not the upper back. That's
In general,
that's the
if
second problem.
it's not getting better in a couple weeks, go see a specialist.